Hello, hello. All right, tomorrow is the day. I'm really excited to share with you guys that I'm gonna have my lift done. Just this little extra through here, and I'm seeing these bands here, so we're getting that taken care of. And we had a busy day in the office. I'm here with my little buddy. There he is. So there he is, Pepper. He's ready for bed, and excited to share and excited to have my lift done. Just a little touch in through here. I have full trust in Dr. Johnson. He's going to do a great job, and I'm not nervous at all. I'm ready to go to sleep. I'm ready to have an excuse to just lay down and do nothing for a few hours while they do my procedure. I don't even need the Valium, but I think Dr. Johnson wants me to take some. But yeah, now I'm excited to actually be the patient. The doctor gets a taste of his own medicine, and we get to see patients do it every day and change their lives, and I just want to keep up. We don't want to wait until the aging changes catch up with us. I've got my little crease here from my I was wearing my PAPR today, doing treatments today. So Dr. Abby, she's covering for me. I checked on all my patients. Everybody's doing good. So here we are. Yeah, let us know if you have questions. And I know what it's like for my patients. I've been through. I've had neurosurgery in the past. I've had kidney stones. And so, but this will be a different experience. And we'll be sharing it with you. We'll be doing videos. So let us know if you've got questions. But here we are, and definitely excited to move forward. A lot of preparation and planning have gone into this. And so, yeah, it's my turn now. See you tomorrow. See you tomorrow, Pepper. So who's the next patient?
I think it's you, Dr. Rich. I think you're up next.
I'm ready. We've had a busy week, and thank you for doing my lift. It is an honor, and I'm excited. We were just talking in the hallway that doing our consultations, we're so often saying, hey, if you like what you see when you pull back, but they're like, I do like what I see when I pull back, so we're going to get this handled. So, but it's really an honor to work with Dr. Johnson. He is, he's from the Midwest, and he's an athlete. He's a true artist. He does his rugby, motocross, stays fit, and just is always raising himself to the highest of standards in everything he does. And now that you've been with Imagelift over a year now, and he's taken this local anesthesia technique to a whole new level, I love watching him operate. I learn. I like to be the Dr. Johnson fellow when he trains. He has his students that come through and train, and the residents that come through and train and learn from him. And I'm one of those learning as well, and now I get to be the patient as well. So we hope you get to learn a few things. And but I really appreciate you doing this for me. It means a lot.
Thank you. It really means a lot to me that you trust me to do your lift. So, we do these lifts, tons of them every week. You've done, what, maybe 5,000 facelifts now, right? And what made you decide, now it's my time? You've seen so many people go through amazing transformations, change so many lives. Dr. Rich, the smile doctor, right? How many people out there smiling, loving their results when they look in the mirror because of you? And now you've decided you want this for yourself. I think as facial plastic surgeons, a lot of times we don't share these things, right? But we're around it all day long. We're not immune to these feelings, right? We also want to look younger and feel great about ourselves. So what made that transition for you? Why did you choose this?
Yeah, well, we look good, we feel good, and of course the smile always looks the best, right? When I smile. But I look in the mirror and I'm like, hey, this is how you feel.
Yeah.
You feel like this. And I don't want to feel like this. Don't get me wrong, I love my life. I'm super happy. But when I see I've got this extra and I'm sitting there doing this all day and I'm like, oh yeah, let's go. So yeah, I do my workouts, I eat well, and I'm 53 years young. Thank goodness I'm in good health. I've had my kidney stones. I had that neurosurgery procedure. I had the pituitary adenoma. I've made it through those things. My kids are almost all in college now. So, just a little bit for dad. And, it's my time now. Why not? Especially when you got this great team. We're right here. I'm like, hello. And I messaged Dr. Johnson. I'm like, are you busy on New Year's Eve? I've got a case And I said, by the way, it's on me. Is that okay if you do my procedure? And he was like, absolutely, yeah, no problem. So here we are, but that's the reason why. Yeah, look your best, feel your best, and you know, that brings us, here we are. I've been doing my injections, and once or twice a year I'll build up my collagen in my face, and I love that. I would do my own lift, but that's a little harder. And but I'm ready to go. I'm ready to take my nap. In fact, I could lay down and fall asleep right now. I'm so comfortable, I'm so relaxed. I didn't even need to take the Valium last night. I'll take a little something today, but I'm ready.
Wonderful. Yeah. Perfect. Well, we're gonna get started.
Yeah, this is the easiest I've ever had in the office. I just have to sit here.
Perfect. We're here with our wonderful patient, Dr. 𝗏𝐁𝐂𝐂𝐿, the Smile Dr. Castellano. We'll be doing a deep plane face and neck lift today, and then some laser resurfacing after that. So we're gonna start with just some marking. And so for the neck incision, we're gonna mark kind of the midline of his chin, so that's centered really well. And then we're gonna mark called the internal border of the mandible. And then we see once the face is lifted where that's going to move to, make sure that our incision's going to stay under the mandible here. And it's about, you know, maybe 2 centimeters, 2.5 centimeters, the incision there. And then we'll go, actually, all right, let's see better this way. Mark the side of the face here, so we can choose, you know, a post-tragal or a pre-tragal incision. And his skin, you can see the ear skin quality very different than the facial skin quality, especially with the hairs. And he already has a nice crease here when we fold the skin there. So we're going to use that really nice crease he already has. And then along the helical root here, we'll kind of fold and see where that is there as well, that natural fold. And then in a man, obviously the hair can go right to the beard, so we don't have a temporal hair tuft to go around. So we're just going to hide this incision up here through the hairs, so it's not visible. Once his normal kind of sideburn grows back, you won't see any of the scar. It'll be all hidden inside the hairline there. And then we leave a little bit of skin here right along the lobule. Then we'll come back in the crease here. I call the helix touch point. You can see where when you press on the ear where it goes to, so we can hide the incision as best as possible there. And then we kind of follow here, but back in the hair, so kind of where the darker hairs start. We'll see how far we need to extend that. We'll mark a little bit further than we need to go. That way, if we do need to extend it, we get a lot of mobility and movement of the neck skin. And then again, that incision can all hide kind of most of it in the hairs there. Okay, and now for the side markings of the face, we have the gonial angle here. So lateral orbital rim here. Our traditional deep plane entry points kind of from the lateral orbital rim down to the gonial angle. We're going to do, you know, a modification where we're going to include more of that mass in the cuff so that it's going to come back up right to where the incision is. That. Now, when you raise this flap up, it's going to inset that way. The good thing about that is none of this skin here is getting elevated. And so when we laser resurface, we can do a full depth laser if we need to. We're doing more of a fractionated CO2 today. We can do that because once flap is set up here, there's very little skin that's actually elevated other than right behind the ear here. And as far as where his neck's going to go, we kind of mark back here where the hyoid is going to be, and then we're going to elevate just a little bit beyond that as far as our lower border here, so we can know kind of where to inject. And we're going to leave some skin and muscle attached here. We do call the preservation deep plane facelift, some people call that. Basically, this means less undermining of the skin. And so this area here is going to stay attached. And so we're only going to elevate the skin here under the chin. This way, when we're pulling on that platysmal flap and recreating its jawline, you can see the skin quality in the neck improves more than if we're, and especially the submental skin control here as well. That's our markings for this first side. We'll do the same thing on the other side. All right, that's all our marking's done.